I just one day woke up in excruciating pain and it just didn't go away.
That was in 2013 because fibromyalgia symptoms often mimic symptoms of other conditions. Getting a diagnosis was a lengthy process.
With fibromyalgia, there's no test for it. Right. So you have to take a bunch of other tests and rule out everything, and then you get your diagnosis.
1 year after waking in excruciating pain, Ronni Dyson got her diagnosis, and the disease changed her life.
I'm not able to be the mom that I want.
Dyson's daughter was only 3 years old when Dyson was diagnosed. Now a preteen, Dyson wants to be there for her.
She would like me to be more active with her, and I just have to say I need to rest, or, it hurts too bad.
So Dyson decided it was time for a change.
I've been researching, medical marijuana for a while.
And so had neurologist Dr. Chad Domain. He's invested countless hours into research on the most effective techniques to manage chronic pain.
I always joke with my patients when they're going from opioids to medical marijuana, I say that you're going from McDonald's to Whole Foods.
Dyson says past experience with other doctors made her nervous about her first appointment with Dr. Domain.
He was very comforting and knowledgeable about everything.
And as he's done for many other patients, Dr. Domain determined medical marijuana would help Dyson's condition and wrote a recommendation for her. Pharmacist Rustin Henry says from there, the process is simple.
You come to the pharmacy and pick up your recommendation just like you would any other medication.
So this is the CBD oil, and this is the THC.
Dyson started taking medical marijuana at the end of October, and she says it's already had a life-changing effect.
My pain level on a score of 1 to 10, maybe like a 3 or a 4 at the worst, and I was waking up every day with a pain level of 10.
And now?
When I wake up, I feel like I can conquer the world. I had the energy to do everything. I'm wide awake. I can focus.
Dr. Domain and Henry both agree the benefits of medical marijuana don't end there.
3 months ago, when I gave my first medical marijuana recommendation, was the first time I administered a medication that didn't have as a possible side effect may cause death.
One of the beautiful things about this is that medical marijuana is safe. There's no overdose.
But there is a drawback.
The issue that I'm faced with and they're faced with is the cost. It's $180 for 1 vial of medical marijuana.
And medical marijuana is not covered by insurance. Many patients can't afford it. In addition to the expense, WDSU medical editor Dr. Corey Hebert says not all patients experience the same results.
Medical marijuana is not a cure-all, okay? It is something that has been shown to work in cases, but in some cases it does not work.
Clinical trials have been restrictive and limited. Other arguments against the use of therapeutic marijuana: frequent use can affect short-term memory and impair your cognitive ability. And those opponents say there is a slight risk of abuse and addiction.
The reality is that anything can be addictive. Anything can be addictive. So medical marijuana can be addictive just like any other medication can be addictive, especially if you find yourself relying on it every day.
As for Dyson, she admits it's expensive, but
it's so helpful in such a short amount of time that it's worth it.